Good morning, everyone. Welcome to the Distinguished Speaker Series. Just a few housekeeping before we start. This webinar is being recorded and will be available for viewing on the UH-RNE Institute website. Also, please mute your microphones during the presentation. If you require any technical assistance, please contact the RNE team, Nicole Bollinger or Abigail Jonah, who are on the call. If you have any questions, you will have to use the chat function of Zoom. Questions can be seen by all attendees, but if you prefer to submit them anonymously, you can do that. And for those who have been invited to the meet and greet session following the presentation, please remain on the Zoom after the Q&A portion is completed. So for those of you who don't know me, I am Samudra Gupta Bora. I'm the founding director of the Health Services Research Center at University Hospitals in Cleveland. This center was established in January 2024 and focuses on healthcare delivery science, health equity, health outcomes, implementation science, and population health research. Our vision is to catalyze excellence and national leadership in the development, evaluation, and translation of evidence and policies to improve the efficacy, efficiency, and equity of healthcare delivery. As part of our scholarly commitment, we are launching the Distinguished Speaker Series today. This series will run from June 2024, so from this month until May 2025. This is a free public event and will take place on the first Tuesday of each month from 11 a.m. U.S. Eastern Standard Time. Each month will feature an internationally recognized expert to share their perspectives on major themes in health services research, population and public health, and leadership that influence health and healthcare in the United States and around the world. And now I'm delighted to introduce Professor Sara Bleich of Harvard University as our inaugural speaker of this series. Professor Bleich is the inaugural Vice Provost for Special Projects at Harvard University. Carol K. Forsheimer, Professor at Harvard Radcliffe Institute, Professor of Public Health Policy at the Harvard T.H. Chan School of Public Health, and a faculty member at the Harvard Kennedy School of Government. She is a policy expert and researcher with over 180 peer-reviewed publications focusing on diet-related disease, food insecurity, and racial inequality. Professor Bleich previously worked in the Biden administration as Director of Nutrition Security and Health Equity at the United States Department of Agriculture, Food and Nutrition Service, as well as Senior Advisor for COVID-19 in the Office of the Secretary. During the Obama administration, she served as a White House Fellow, assuming the role of Senior Policy Advisor for Food, Nutrition, and Consumer Services, and contributing to the Let's Move initiative led by First Lady Michelle Obama. Professor Bleich was elected to the National Academy of Medicine in 2023. We are delighted to have you here. We appreciate you accepting our invitation and joining us today. Thank you, Professor Bleich. Over to you.
Thank you so much. I appreciate it. It's great to be with all of you. Let me share my slides, make sure you can all see them. So it's great to be with all of you. What I wanted to do was tell you a little bit about myself before jumping into a bit more of the science and policy work that I've been doing. And I find it is always very helpful to have a sense of how someone comes at the work that they do. And I'm guessing, like many of you, I'm also very much inspired by the path that I have walked through my family. So I'm mixed, Black and white, and featured on the left is my mom's dad, and that's me. And then on the right is my dad's dad. And my mom's dad was a corn farmer in Maryland and left high school so that he could work in the cornfields. And then my dad's dad was a radiologist in New York City. And I grew up very close to both of them. And I'm from inner city Baltimore, so I grew up in Baltimore and probably saw each of them at least once a month. And I remember distinctly two things. One is my grandfather, the one in Manhattan, lived at the time in a building that had one of the fastest elevators in New York. And so you would go up and down and like your stomach would flip flop. And you would walk into the building and the doorman would know your name because you had a family member that lived there. And then I remember being with my corn farmer grandpa sitting in the back of his truck on top of a bunch of corn while he walked into a grocery store called Safeway, which is a big grocery store in the mid-Atlantic, and wanted to sell his corn. But he felt as though they weren't giving him a fair price because he was Black. And I just remember thinking, I love these two people equally, but the world treated them very, very differently. And as I mentioned, my childhood was inner city Baltimore. So this picture is me on the left, my brother in the middle, and my twin sister on the right-hand side. This picture was taken at Memorial Stadium, which if you know Baltimore, this is where the Baltimore Orioles used to play, the baseball team that's still there. And it's about 1.5 miles from the house where I grew up. It's also where I learned how to ride a bike. And my parents still live in a house, in that same house, which is about 1.5 miles from where this picture was taken. But I put this up there because one of the things that I have learned is it's really important to let people know where you come from. In my case, my family received a number of nutrition assistance programs when we were little. So we received SNAP, we received WIC, we received school meals. And if I don't tell people that, they don't know it. And what I have found that it has been very helpful with doing is reducing the distance. Coming from Harvard, people have me at arm's length. Adding to that, for the first years of the Biden administration that I was a Fed, people had me at arm's length. And so in an effort to build trust, to draw on areas of familiarity, I've always made a real point to talk to people about the experiences that I've had that have made me so passionate about the equity space and about food nutrition policy. And then I'm sure, like many of you who have the opportunity to listen, I'm very much inspired by my girls. And so that's Cecilia on the left and Natalia on the right. In this picture, they are just 10 and just 12. So Cecilia just turned a double-digit number. She was very excited. And they are about to turn 11 and 13. So I am walking into the teenage years with a healthy amount of fear. But, for me, I look at them and I see two very spirited young women who are fun and exhausting and smart and athletic. But I also see two little Black girls, and the world is going to treat them differently because of the color of their skin. And that is highly motivating for me in the work that I do to really think about how do you create opportunity where it doesn't always exist? Because if I've learned anything over my career so far, and just through personal experiences, it's that talent is everywhere, but opportunity is not. And so through my research career and through my policy work, I'm always trying to think actively and constructively about how do you create opportunities for those that may not have them. So when I left Harvard, I did my PhD there. I went to the School of Public Health at Hopkins and was there for about 6 years and found myself getting a little bit antsy. I wanted more policy experience and I wanted to do something outside of the ivory tower. So I had the great privilege of serving as a White House Fellow in year 7 of the Obama administration, as Sam mentioned. And there were 3 main reasons why I wanted to go into government at all. And I'll be honest, I didn't think I was going to like it. In fact, I thought I was going to hate it. But I went into it because I wanted to really understand, so what role does science play in the policymaking process? And I wanted to jump in with 2 feet, not do it on the side in between all the other grants and the papers and the service, but really jump in and understand the policymaking process. And then finally, figure out what differentiates some people from being successful in policymaking spaces. What are those soft skills that really separate out those that are very effective versus those that aren't? And I will tell you that despite going into it with the mindset of, I'm not going to like this, I ended up loving it. Totally, as you would say, if you're from Baltimore, I totally drank the Kool-Aid and had just a wonderful experience. And here's just a snapshot. So the White House Fellows Program is your class, and it's a year-long class. And so here we are with President Obama in the Oval Office. Another nice thing about the program is that there are all these opportunities to go to the White House campus and bring your family. And so on the left 2 pictures are my girls at the White House for Halloween. And it's a little bit hard to tell, but on the bottom left, There's little Cecilia who's trying to trick or treat from a gentleman who's juggling on a ball. And what you can't see is his face, and he's laughing at her because he's probably thinking, I'm out of arms, sweetheart. I cannot give you candy because I'm juggling on a ball. I mentioned that I have very energetic children. That middle picture is we were on a tour of the East Wing, and I lost my children because they were running around playing hide and go seek, and which is a game that they still love to this day. And I found them right here under this table, worried that they had been like tased by Secret Service. So I had to take a picture, but then obviously reprimanded them and kept them very close after that. And then on the right is my big one when she was, I guess she was only 4 in that picture, at the Easter egg roll at the White House. As Sam mentioned, I had the privilege of spending the first 2 years in the Biden administration. And the first role was as a senior, and this was January 2021. So, oops. I just got a note that says Zoom quit. Are we still, can you guys still hear me?
Yeah, we can hear you.
Okay. I hope that the video is not choppy.
Nope, it's
Okay, I'll keep going. So when I took on this role, it was January 2021. This is the height of the COVID pandemic. So about 3,300 people are dying per day. I'm sure you all well remember this, as many of you are health professionals. Vaccines were not yet widely available. There were new variants on the rise, and the science was rapidly evolving. And my job was to keep about 100,000 people safe, which is the USDA workforce. USDA is the US Department of Agriculture. And it's a very diverse workforce with offices in every county in the country, and about 80% of the workforce outside of the DC metropolitan area. So just a lot of logistical challenges to how do you actually reach people that don't always check email or only check it in some cases once per month. So learned a ton in that role. It stretched me tremendously. I really leveraged public health skills that I didn't know that I had. I learned skills that have since become invaluable. And after that first year, I then turned and went to my passion area, which was food nutrition policy, and spent the second year as the Director of Nutrition Security and Health Equity. This picture here was taken on my very last work trip. So this is January 2023. It's my last work trip. I'm in San Francisco visiting what's called a child and adult care feeding program. So you can think of this as a daycare in someone's home where kids go, and then USDA is helping with the food part of the program. And this was, you might remember this was when San Francisco was having these torrential rainstorms. We're there right after the rain, but it's still drizzling a bit. And we're at the daycare, and it had been raining outside that morning, and the sky finally closed up, and we got to go outside and play with the kids. And so this is me hula hooping with the kids. But I put this picture up there because for me, the really exciting thing about the job was the ability to go around the country and see the nutrition assistance programs in real life, of which there are 16, which touch 1 in 4 Americans over the course of a year. So really impactful programs that are helping to drive nutrition security and health equity. I often get asked, what are some of the key takeaways from federal service? And these really are the 5 things that bubble up most. I'd say first and foremost, I don't know of another way that you can have impact like you can in federal government, because even very small changes in policy can have massive impacts to large numbers of people. The thing that really took me aback in the Obama administration, and I'm constantly reminded of, is just how important the career staff are. So the political appointees, of which I am one, or was one, represent a very small fraction of the federal workforce. The vast majority are career staff, which stay administration over administration, and they carry so much knowledge and so much historical information, and frankly, are the main workhorses that get the work done. And so it has just been my privilege to both work with career staff and continue to stay in touch with them. The skill that I used most by far is communication, oral and written. And it was not uncommon for me to be briefing, say the secretary, and that briefing, which was supposed to be 15 minutes, gets reduced to 3 minutes because of all these different competing priorities. So being able to quickly condense down information, to synthesize it, say the important things, and then stop talking and hear the questions is something that I really had to develop. The last 2 here are just the importance of recognizing that in federal government, particularly as a political appointee, you really can't control the day. I'd say, unlike academic life, where 80% of my schedule, if not more, is predictable. It's more like 20%. So it's the reverse in federal service. And so you really have to be able to roll with the punches to recalibrate as needed. And then finally, everything turns on relationships. So a little bit about my research. So I mentioned that broadly, I'm interested in food and nutrition policy. And here are the four main buckets that my work has fallen into. All of it is really with this eye toward how do you reduce obesity? How do you reduce diet-related diseases and disparities? And how do you generate the evidence that can help drive policy? And so just to give a tiny bit of context, then I'll move into some examples. This is a paper that was done by Zach Ward, who's on faculty at the School of Public Health. And what it's doing is it's projecting the prevalence of childhood obesity. And you have obesity prevalence on the vertical, you have age measured in years on the horizontal. The first take-home point from this slide is that if you look at today's 2-year-olds, 50% of them are expected to have obesity by the time they reach age 35. Take-home point number 2, if you look at that box in the lower right-hand quadrant, is that a much higher percentage of Black and Hispanic 2-year-olds are expected to have obesity by the age of 35. So big projected disparities in childhood obesity prevalence. We find the same thing for adult obesity. This is a paper that I contributed to, also led by Zach Ward, and this one's looking at adult obesity. And what you have are maps of the United States with whites in the upper left-hand quadrant, Blacks to the right, then on the bottom, Hispanics and non-Hispanic other. The first take-home point here is that 50% of adults are expected to have obesity by 2030, which is not very long from now. The second take-home point is that for Blacks, severe obesity, which as you know is carrying around about an extra 100 pounds, is expected to be the most common BMI category. So very sobering numbers. And then an area that I've spent a lot of time focusing on is sugary beverage consumption. And what the evidence shows here is that there have been declines over the past decade, but levels still remain unacceptably high, particularly for Black populations. And then we also know that food insecurity, which is a lack of adequate access to food at some point during the year, is not only on the rise for the first time in a decade, but also disproportionately impacts historically underserved populations. So from that orientation, all the work that I've tried to do really focuses on the bottom of this pyramid, recognizing the importance of counseling and education, recognizing the importance of clinical work. I've long been interested in how do you make systemic and structural changes that can really make a difference and hopefully help keep someone out of the healthcare system, really with a preventative mindset. So I want to just give you a couple of examples of how this work has come to life from a research perspective. The first is federal, and the next one will be local. And so for the federal side, I want to talk about the work we've done in menu labeling. This is something I'm sure you've all seen in your day-to-day life. It was included in the 2010 Affordable Care Act, and it was the rule that chain restaurants, large chain restaurants with more than 20 outlets around the country, had to post calories alongside price. And here are just some examples. I got very interested in the impact that it would potentially have on restaurant behavior. Much of the research in this space has focused on, well, how do consumers behave differently when they walk into stores and they see that, or walk into restaurants and they see calorie information posted? But I was really interested in, well, what are restaurants doing to modify their menus, and what would that do to available calories? And so we did a systematic review, and one of the things that we found is that the story of menu labeling really appears to be on the restaurant side. That on a per item basis, when you look at newly introduced items, calories are going down in restaurants by about 120, and that the change in consumer behavior is considerably smaller. The other thing we found is that restaurants are also dropping the highest calorie items off the menu. Now, these changes are important because, number one, it is not relying on individual behavior. These are changes that are happening on the menu amongst either high calorie items or newly introduced items. And we know that human behavior, as you see, I'm sure, all the time in your clinical work, is very resistant to change. And so doing something that is happening in the background without much awareness among consumers actually becomes really important for sustainable behavior. So from this idea of calories and posting them on menus, I got to really thinking about, oh, how do you actually make them more meaningful? And the reason I was very interested in that is most people don't understand the amount of calories that are in their food. If I surveyed all of you, a very educated group, chances are many of you would underestimate the number of calories. There's also a challenge of being able to do the math that's required to say, well, I've had this many calories and what percent is that of my total daily intake? And so really want to think about how do you make calorie information more meaningful? And I really wanted to do a study that did work in inner city Baltimore, where I'm from. So when I was at Hopkins, did a study which was funded by the Robert Wood Johnson Foundation that went into Baltimore City corner stores. And these are just some of the examples of the stores that we used. If you go into stores to urban areas up and down the Eastern Corridor, as well as in, say, Detroit, you will see corner stores just like this. They're small. They serve a lot of ultra processed foods, a lot of beverages, and they typically have a bank of beverages on one of the walls of the store. And so the intervention was to go into that bank of beverage cases and to, one at a time, hang one of these signs. And the purpose was to give you, with the exception of the first sign, the exact same information you would get if you turned a bottle of soda around, but do it in a way that was more meaningful. And so we said 50 minutes of running, 5 miles walking, 16 teaspoons of sugar, and then look and see what that did. What we found is that when you posted information, that meaningful calorie information, particularly telling, and the target was Black adolescents, telling them they had to walk 5 miles to burn off this bottle of soda, reduced the calories they purchased, reduced the likelihood of buying a sugary drink, and in some cases, reduced the likelihood of buying a larger drink. And that continued after the intervention and the signs had come down. So it showed some persistence. And then I was very pleased that this work was picked up in Philadelphia as part of their Fit Philly campaign. It was picked up in Lincoln, Nebraska as part of their Healthy Lincoln campaign. And so that was just for me a very rewarding aspect of translation. I said that I was going to give you a local example, but now I'm remembering our time is not that long, so I cut that out. But it was around the work that we've done around sugary beverages and the case of Philadelphia. So in our remaining minutes, I do just want to take a little bit of time and completely switch gears and give you a sense of where I am now in my career. So I did the first 2 years, as I mentioned, the Biden administration, returned to Harvard and was recruited to take on an administrative role. So I still have, as Sam mentioned, I still have a foot in the School of Public Health, but now I sit in the office of the president and the provost and serve as a vice provost for special projects, with right now primary responsibility for overseeing the Legacy of Slavery initiative. This is something that was birthed with a report that came out in 2022 in April, so just about 2 years ago. This report is a rigorous research document and really tells us 3 things about Harvard's complicity in slavery. The first is that Harvard leaders, faculty, or staff enslaved more than 70 people that we know of during the 17th and 18th centuries. The second is that Harvard has financial ties to slavery. So 5 men who made their fortunes in slavery or slave-produced goods contributed 1/3 of all financial donations or pledges during the first half of the 19th century. And the third truth that the report revealed is that Harvard has intellectual ties to slavery. So Harvard leaders, Harvard faculty, Harvard staff promoted ideas around race science, around eugenics. This was in the 19th and 20th centuries. These are ideas that have since been debunked, but they underpinned Jim Crow segregation. They, for some, continue to underpin white supremacy. So also included in the report, and based on these difficult truths, were a series of recommendations which have been embraced by the corporation, the Harvard Corporation, and by the president at the time, President Larry Bacow. I won't go through these recommendations in detail, but if you just sort of skim them, what you can see is that they're quite broad, and they include efforts to engage different populations, as well as ensure that through this work, the university is being accountable. Now, I've been in this role for a little over 1.5 years and have done a lot of presentations about the genesis of this work, which the path really started about 15 years ago at the university, and then where we're going with this implementation work that I'm leading now. And I would say that probably one of the number one questions that we've received is, well, slavery ended over 150 years ago. Why are we focused on it now? And the message that I would leave with all of you, which I'm guessing many of you are aware, is that the key legacy, if not a key legacy of slavery, is structural racism. And As a result of structural racism, there are inequalities across just about every aspect of American life. A common theme for all of us is certainly in the health and healthcare setting, but it also extends to transportation and education and housing, and the list goes on and on. And through this work, through the Harvard Legacy of Slavery, our working hypothesis is that, if we hold Harvard accountable for our very difficult history, if we enable collaborations and partnerships and other actions that address systemic inequities, then we will meaningfully impact two populations. One is direct descendants. These are people whose ancestors were enslaved by Harvard leaders, faculty, or staff. And the other is descendant communities. This is anyone who's been directly or indirectly impacted by chattel slavery. And I do just want to add that while we hoped to have this impact and to meaningfully show progress, we are not naive enough to think that we, Harvard alone, are going to solve these large, persistent problems around structural racism, but we do believe that we have a responsibility to do our part. So in terms of where we are in the arc of this work, I mentioned that the report came out that really launched this off in 2022, so 2 years ago. My office was established. There's been progress against each of those recommendations that we looked at briefly, and we are continuing to do that work in the coming year while also thinking strategically, because we cannot boil the ocean, about where we want to really invest resources and prioritize action. And I will say that this work is supported by a $100 million endowment that was also approved at the time the report was released by the corporation and the Harvard president. The other thing that's unique about this work, before giving you a little bit of a preview of some of the accomplishments to date, is that we are not just focused on the university and its core stakeholders. That is certainly very important, but so too are a number of other groups, like historically Black colleges and universities, like the broader state of Massachusetts, like other universities that have ties to slavery. There are about 500 to 600 universities around the country who were founded prior to 1865, meaning when slavery was still legal. If even, I should say, a fraction of them began exploring their legacies of slavery and committed resources to it, it could really make a meaningful impact on the communities that we are trying to reach. So just to give you a few examples of where we made progress, we this year launched our very first grant program called the Reparative Partnership Grant Program. And that grant program is unique for Harvard in that, number one, it requires that projects be co-led, so that they have to have a university partner and a Harvard partner. It requires that once funded, 60% of the funds flow from the university out to the community groups that we are partnering with. And we just earlier in May announced the first round of recipients, and those are going to both seed grants, which are $25,000 for up to a year, and impact grants, so up to $350,000 for 2 years. And just to give you a few examples of what some of those funded projects look like, there's a project between the Harvard Law School and the Boston Law Center, which is looking to think about how do you help with Black home ownership? How do you create a toolkit to help support that? There's another project between the Mashpee tribe, which is a regional tribe in New England, and the Harvard Divinity School to think about archival preservation of tribal information. Those are just two examples of really exciting work that has been funded through this initiative. We also have made a point to try to get information about the legacy of slavery in front of all incoming students, as well as faculty and staff. And the reason why that is important is that, if you are privileged enough to come to Harvard, then we expect that you will go off and you will do well. But our hope is that if you are armed with this knowledge about the legacy of slavery and the history of this institution, that you also go off and do good. And so we are actively looking for ways to integrate this work into the course materials at the school, and then taking every opportunity that we can to really think about how do we engage with community members to rinse and repeat and just keep sharing the information that we've learned and the implementation path that we are trying to walk. We've had the opportunity to make a lot of progress with our partnerships within the space of historically Black colleges and universities. So last spring, we announced a partnership with the AUC Woodruff Library, which is in Atlanta and serves the HBCUs in the Atlanta region. But this partnership is through the AUC Woodruff Library and the Harvard Library, and it aims to look across all roughly 100 HBCUs to digitize archival content and make it publicly available. And that project is well underway. We also, based on conversations with many of the leaders of the research intensive HBCUs and other conversations over the past year, had the opportunity to stand up a number of partnerships. I'll just mention two. Some of these are led by units within Harvard, and some of these we're doing within partnership. And so just to give you an example of each, the Faculty of Arts and Sciences, which is the biggest unit at Harvard, it is standing up this fall a visiting professorship program, which is, for now, it's faculty from HBCUs that are coming to Harvard for a sabbatical or a year to both enrich our environment and give us the opportunity to learn from them. And then they'll have the opportunity to take advantage of resources here at the university. So we're very excited that that project is starting in September. And then later this week, actually, we are launching a program that is being done jointly with Harvard College, and it's called the Du Bois Scholars Program. Du Bois was the first Black individual to get a PhD from Harvard. And this scholars program brings in rising seniors and juniors from research intensive HBCUs. We are partnering with 13 this year, and we're bringing in 20 scholars. And what these scholars will do is be integrated into the Harvard Summer Research Village and have a chance to do research over the summer and then present their work. So we're really excited to welcome this cohort of students later this week. I just want to wrap up by encouraging all of you to just really think about, throughout your career, allow for serendipity. If you would have asked me 5 years ago, do you think you'll be working on legacy of slavery at Harvard? I would have said, huh? If you would have asked me 5 years before that, do you think you're going to be in the Biden administration doing COVID? I would have said, what does that mean? What's COVID? And so you really don't know where your life is going to take you. And I think it's important to do two things. To number one, to know what it is you care about most. If I look back at my application to my doctoral program, it basically says, I want to help underserved populations achieve a more meaningful quality of life. And I have been chasing that North Star for the past 25 years. The other thing I've tried to do very deliberately is always ask myself, does this opportunity fit within the place that I am in my professional life and my personal life? So I'm getting married in a few weeks, but for the vast majority of my girls' lives, I've been a single mom, which has meant I've had to make difficult decisions because first and foremost is I'm a mother and I have to put my girls first. And so that has meant that I have said no to certain jobs, but that's okay because, the time has to be right to do the things that you care about. And then the final thing I would say is always ask yourself on an active basis, am I happy with the work that I'm doing? And if you're not waking up excited every day about the work that you're doing, think about how do you make a change within where you are, or think about whether a broader change is necessary. I just end by saying, I am someone who is very much inspired and driven by the words of others. So I want to just leave you with 3 quotes before we open it up for Q&A. One is by Dr. Martin Luther King, who said, the time is always right to do what is right. The second is by the late and the great Maya Angelou, who's probably one of my favorites, not probably, is one of my favorites, who said, people will forget what you did, but people will never forget how you made them feel. This is particularly meaningful to me in the context of the legacy of slavery work at Harvard, because one thing that's really struck me is the level of cynicism about this work. Is Harvard serious? Does Harvard intend to do what it has committed? And so one thing that I really hope to leave you with and leave anyone with who hears about this work is 2 words. Harvard is serious and Harvard is sincere when it comes to our legacy of slavery efforts. And then the final thing is from a children's book. I have read many a children's book in my day, as have you, I'm sure, if you have small children. And this is from Rosie Revere Engineer. If you haven't read this series and you have kids, get it. And there's a whole series of books. This is about Rosie, who wants to be an engineer, but she keeps failing. And at one point she gets very upset and her aunt says to her, life might have its failures, but this was not it. The only true failure can come if you quit. So as I would say to my girls, I wish you all grit and perseverance in whatever it is that you're doing, because I'm guessing that your job is hard, but it's also meaningful. And if it were easy, then anyone could do it, but you're doing it and that makes it important. So let me stop there and would be happy to take any questions.
Thank you very
Thank
much
you very much.
for your insights. And we have questions. We have time for a few questions from the audience. So if you can type your questions in the chat, just remember that everyone can see your questions. If you prefer to post it anonymously, you can do that. Yep, we have time for a few questions.
So thank you very much for the kind words. So what does structural racism mean? Excellent question. And then I'll get to the second half of your question. So structural racism refers to policy, systems, and practices. So not what individuals do, but what institutions and in some cases governments do to basically create barriers to access for underserved populations. And so you can think of one example like redlining, which is an example of how it was hard for Black people to get access to loans to purchase houses. This was a long time ago. And this was done away with by the Fair Housing Act of, I think, 1948. But what you find is that the legacy of redlining still lives on in terms of access in neighborhoods and green space and what things are available in different areas. And so as you think about structural racism, it is not how you and I perceive the world. It is really how broader policies and systems and environments are making it hard for certain groups to get ahead. And so if you were interested in your day-to-day work of thinking about, what are some of the things that you can do to help push against these structural problems, really try to look for ways to change. I'm going to use the word policies again, but look for ways to change policies and practices that do not require individual behavior, but rather make it such that the default is creating more opportunity rather than less. It's an excellent question. And then the second half of your question is, can an institute be a partner with your program? Thank you so much for saying that, because one of the things that I didn't say is that everything we have done so far has been in partnership with others, in part because we don't have unlimited resources. And more importantly, we are relying on the expertise of others to tell us how to do this work. One thing that's very clear is we understand historically our legacy of slavery, but we don't have a crystal ball about how to actually do this work, this reparative work, in part because there are very few universities that have done it. And so we're charting a bit of a new path. And it's very important to us that we try to get it as right as we can, because we hope to inspire others to do similar work in the future. The next question is, how do you respond to political discourse that tries to shut down our acknowledgement of past and current racial biases and discrimination? Another great question. I think that there's no right answer to this question, but I think it's always really important to be factual. So, for example, if we would have had more time together, when I talked about structural racism, rather than talk about it abstractly, I would have given you a number of examples. These are disparities in healthcare. These are disparities in the Black-white wealth gap. These are disparities in educational outcomes. This is not random. This is rooted in a system which has made it hard for some groups to make advances. And so when there's a lot of emotion involved, when buzzwords are used, it can be very hard to have civil discourse. But I think it's really important to attack problems with facts, to listen hard, to hear where there's disagreement, and then to attack that disagreement with facts. One of the things that I've had to learn, largely in this role, but certainly also as a Fed, is that if you listen more, you can hear where the concerns are, and the concerns are not always what you would initially go to. They could be something that's like, oh, I didn't realize, let's unpack that and try to understand it. But talk less, listen more is, I think, a very good lesson for a lot of this work. I hope that answers your question. From Samuel Rogers Melnick, in neighborhoods like Cleveland, residents can sometimes feel like they are being taken advantage of by researchers from health systems. We show up for a study and then disappear when funding ends. How do you recommend working to overcome this history? Yeah, it's such a good question. And this is something that Hopkins very much grappled with when I was on faculty there. Harvard grapples with it. I know Caroline, who's on the call now, probably has a lot of thoughts specific to the Cleveland area and is an expert in community outreach from a research perspective. But I would say, two things. One is that if you're a researcher, then you probably have limited resources to do a huge amount of community outreach after the report is done. But I would say that it's important to think about, how do you make sure that at the very minimum, the results that you have found get back to the communities that you have had the opportunity of working with to lift up and to make your research possible. That's one. Two is to not let, and this is going a little bit beyond community engagement, but to not let the research just live in academic journals. If it has more popular appeal or policy relevance, get out there and talk to the media. One of the things I did more so at Hopkins is I would get on the FM channels a lot, and not just the NPR, because then I'm talking to people, they're not the people that I'm trying to reach. And I'll tell you just one anecdote, which reinforced the importance of being on the FM channels. My girls were really little. They were 3 and 1. I was dropping them off at daycare, and I had just been on the radio the night before on an FM channel. And the host says to me, if you could leave listeners with one message, and the topic was obesity prevention, what would it be? And I said, look, folks, if you do anything, eat less, exercise more, and it will work to your health. And I'm literally walking into daycare, and you have to pass the security desk. And I hear, this happened to be a Black woman. She was a security officer. I hear her talking to another security officer, and she said, I heard it from the good doctor last night. She said, you have to eat less and exercise more. And, you know, it's not rocket science, but it's saying things in an accessible way on a medium that is accessible to people. And I said that was my last anecdote. But the last thing that I'll say is I was really struck when I was in the Biden administration and how many people said to me, it is helpful to see someone like you in a leadership position, not only because you're a Black woman, but also because you have lived experience growing up in a working class neighborhood. You have lived experience being on safety net programs. And so to the extent to which you have a story that informs the work that you do and you're willing to share it, I would really encourage you to consider doing so, because I think it's going to help people embrace you a little bit more. And this goes back to the point about community involvement. But I also think it helps make the work stickier, because it's not just study by researcher, it's study by researcher that has this interesting connection and that people can relate to it. But I want to stop there because I know that we're right at the time we're supposed to be transitioning.
Thank you so much. And for those tuning in, thank you for your time and attention. This was a great presentation. Really appreciate Professor Bleich for sharing a very comprehensive insights of your very exciting career as a terrific scientist and leader. And finally, I'd like to thank my team, Eve Fritz, Nicole Bollinger, Abigail Zona, and Lisa Hackle, who made this series possible. You know, they're the real forces behind having this seamless meeting. So many thanks to them. And this concludes the presentation. For those of you who have been invited to the meet and greet, I'd ask you to stay online on this Zoom. And for the rest of you, have a great day. Thank you for attending.